Welcome to Module 3.17, the second part of our examination of how to critique quantitative research. In this module, we'll move beyond methodological evaluation to consider how research connects to practice. We'll explore approaches for evaluating discussion and conclusions, assessing public health relevance, and translating critique into practical application. These skills will help you bridge the gap between research evidence and healthcare practice decisions. When evaluating the discussion and conclusions of a study, several key elements deserve attention. Consider whether researchers place findings in the context of existing literature. Do they acknowledge consistencies and explain discrepancies with previous studies? Assess limitations acknowledgement. Do authors openly address methodological weaknesses and their potential impact on findings? Check whether alternative explanations for results are considered, rather than assuming the preferred interpretation is correct. Watch for overinterpretation, particularly causal claims from correlational designs or generalizations beyond the study population. Finally, evaluate whether implications for practice are appropriate to the strength of evidence. Strong recommendations should emerge only from methodologically sound studies with meaningful results. This critical evaluation prevents premature application of flawed or overstated findings. Beyond statistical and methodological quality, healthcare research should be evaluated for its public health relevance. Consider population health implications. How many people might benefit and how substantial might those benefits be? Assess practical significance. Regardless of statistical significance, are the effects meaningful enough to justify practice changes? Examine implementation considerations. Is the intervention feasible in real-world settings with available resources? Evaluate cost-effectiveness. Do potential benefits justify the required investment? Perhaps most importantly, consider health equity impact. Does the intervention address disparities, or might it inadvertently widen them? These considerations help prioritize which evidence should influence practice, focusing resources on interventions with the greatest potential to improve population health outcomes. Translating critique into application requires several steps beyond quality assessment. Begin by weighing evidence quality. Stronger evidence should carry more influence on practice decisions. Consider context differences. Results from one setting may not transfer directly to another due to population, resource, or system differences. Identify potential implementation barriers, organizational culture, resources, expertise, or competing priorities that might impede adoption. Consider necessary adaptations. How might interventions need modification to fit your context while preserving core effective elements? Finally, integrate with other evidence. Single studies should be considered within the broader evidence landscape, including systematic reviews and clinical guidelines. This thoughtful translation process ensures that practice changes are based on robust evidence appropriately applied to specific healthcare contexts.